Today, healthcare workers prefer the term substance use disorder. The reason behind that is to reduce confusion, because the term dependence means my body's adaptation to a substance. We talk about tolerance, withdrawal, but it doesn't explain or include how it affects somebody like physically, mentally, and emotionally. But by looking more than just the physical side of substance use, we get a better picture of what somebody's really going through, and that can help us offer better support and care. So in the context of addiction medicine, mental health, using proper terminology can be very important. There's a lot of stigma associated with a lot of terms, like using the word like substance abuse instead of misuse. And using terms that may have less stigma, well, people may engage more in treatment, reach out to other people, and that can lead to just better outcome in general. When it starts to interfere with the relationships, work, school, just their general lives, then they continue to use despite the negative consequences. They lose control over the use of the substance, and that's when it becomes a substance use disorder. Technically, just using a substance is not a substance use disorder, but when it interferes with daily lives and you continue to use it despite the negative consequences, it's that loss of control that's the key element here. There's no official statistic on crystal meth use here in New Brunswick, but we know it's people show up more often to the ERs for crystal meth use. So we know it's here and it's more present than ever, but we don't know exactly the full extent of it. We can divide it in 3 stages. Stages that repeats itself, that can get progressively worse over time. The first one, we can call it the binge or intoxication. That's when we first use the drug, we feel an intense high, the euphoria from it. Our brain's reward system is overstimulated and we feel extremely good because of that. And that can lead to binges that can last from a few hours to even days. Afterwards, well, it comes the second part of the cycle, which is the crash, the withdrawal. That's when we can feel very depressed, irritable, exhausted. It's difficult to feel any pleasure at all. And using again can feel like it's the only way that we can feel better. That's what leads to the third part of the cycle, which is really cravings. The cravings can become extremely intense. It feels like using again is the only way to feel even somewhat normal and to get rid of those cravings. And so that cycle can just repeat itself over and over again. And as we use the drug more often, well, the first part of the cycle, the binge, intoxication, it gets shorter. It can eventually take more of the substance to feel that initial high. The crash becomes worse. And the cravings, well, they get more and more intense. And we need more and more of the substance to feel somewhat normal again, and that just repeats and repeats over again. The main thing is over time with repeated use, it does change how the brain works. Essentially, it hijacks the brain's reward system. We start to prioritize the actual substance. Here is crystal meth over everything else, so over relationship, work, well, pretty much everything else in your life. And when you start prioritizing that substance over everything else, well, the substance becomes a priority and you kind of neglect pretty much everything. Food, relationship, family. At this point, the individual will take a lot more risk just to acquire the substance. And that's not just to get the high, it's to get rid of that crash, get rid of those cravings, and just to feel somewhat normal. For you, anybody struggling with substance use disorder, crystal meth, or any other substances, can be alcohol or even opioids, well, there's a lot of service available here in New Brunswick. Psychotherapy, counseling available at 81 Albert. We have the addiction outpatient clinic available in 125 Mapleton. There's the detox unit also at 125 Mapleton. There's even the intensive day treatment program here in Moncton that can offer one-on-one therapy, group therapy, and those are specifically more for Moncton. But if you look up addiction mental health on Horizon's website, there's a lot of different services that can be available for all the different places throughout the province.